All right, we are going to get started with our breakout session on REACH funding opportunities. Okay, so I'm Cara Cuite. I am moderating this session, and I am pleased to introduce Dr. Denise Rodgers and Diane Hagerman from REACH, the PI and Executive Director of REACH.
So we told her to do like really short introductions, you know, because it's like enough already. For those of you who don't know, what I will say is I'm a family physician, and the reason that's relevant is that the way I got interested in this work is it got really, really clear to me as a family physician working entirely with under-resourced populations, is that what I was doing with people in the office was like making kind of sort of a bit of a difference. But these were really the issues that were making a significant difference or would make a significant difference in people's lives. So that's kind of the bottom line. So first we're going to start with a short video from our REACH website.
Imagine living 10 miles down the road from your cousin. People in your cousin's town have more access to grocery stores, better schools, higher paying jobs, and better housing. But you don't. Because of differences in these social determinants of health, your ability to live the healthiest life possible is compromised when compared to your cousins. Unfortunately, this is true in many New Jersey communities. People's health is affected by their zip code and other long-term structural factors. The Rutgers Equity Alliance for Community Health, REACH, is an initiative born to address these issues. Starting in the 3 communities where Rutgers has its campuses, Camden, Newark, and New Brunswick, we're using an evidence-based and collaborative approach that unites the expertise of community leaders and Rutgers faculty and staff. The goal is to develop sustainable, long-term solutions focused on 5 specific social determinants of health: education, employment, food access and security, housing, and population health. In this way, REACH is building alliances with communities, academia, policymakers, and private sector leaders. These lasting relationships can promote policy and systems change, bringing sustainable growth and improved health and socioeconomic outcomes to the lives of New Jerseyans. Health disparities are preventable, and health equity is possible when we work together. Let's build bridges to reduce the gaps in our communities. Learn more at reach.rutgers.edu.
So we're just going to take a second to put up the slides, and then we'll go quickly. And go to the next slide. No, you can skip that. Yeah. So just to reinforce, one of the hardest things we had to do when we started REACH was to figure out what are the things we're going to focus on, right? And so we're only focusing on 5 social determinants of health. There are clearly many others. You don't see transportation up there. You don't see neighborhood safety up there, that sort of thing. And so we're just doing education, employment, food access, housing, and population health. And we could spend a whole other session trying to define what population health is, so we won't go there. Obviously, one of our goals is to sponsor a conference during the course of our grant that focuses on each of these areas. And so this food conference is our first, and thank you very much for you and your collaborators for putting together this wonderful conference. Next slide, please. So we really do believe that there's a lot of expertise within communities that if we bring together with the expertise of faculty, that we can come up with some better solutions. So that's the tagline, and that is actually what is our reality of truth. Next slide. As you saw, Camden, New Brunswick, and Newark. Next slide. And what I also want to start with, though, is a reminder. So you think you're here just about food, but we're going to move a little bit beyond just food and talk about this notion of health equity. Because part of what, if you read the definition of health equity, what it takes to get to health equity, it's all about social determinants of health at the end of the day, right? It's about these obstacles that get in the way of people being able to be as healthy as they possibly could be. Next slide, please. When we talk about health disparities, it's really, really important that we emphasize to everybody that these are preventable differences. There's sort of nothing kind of biologically based about these, and they, again, are largely related to social determinants of health. Next slide. And so this is what life expectancy looks like in New Jersey by race, ethnicity. And and this is 2020, the most recent data that we have from the Health Department website. A lot of these slides are going to be from the Health Department website. But you know what? If you were to go back 20 years, 50 years, probably 100 years, you would see this kind of disparity, certainly between blacks and whites in the state of New Jersey. And by the way, the kind of disparity we see here in New Jersey is reflective of the kind of disparity that we see throughout the United States. Next slide. And so part of the reason that I show this slide is the yellow line is African Americans, and so we see that African Americans have the highest age-adjusted death rates and have had the highest age-adjusted death rates for the last 20 years. Again, it's probably 15 or 100 years. But I also want us to all pay attention to this uptick that we saw during COVID as a reminder of the impact of COVID. Now, what I also want to say is that while most of that uptick is COVID, some of that uptick is also deaths from what they call accidents and what is really drug overdose. And so we saw significant increases in drug overdoses during this period of time as well. Next slide. If we look at the leading causes of death in New Jersey, these are 10 leading causes of death. 8 African Americans are more likely to die in 8 of the 10 leading causes of death in the state. Next slide. And so Michael Marmot, who actually is from Great Britain, did the original work on social determinants. So this isn't actually an American phenomenon. This is actually a phenomenon that started in Great Britain. And the interesting thing about Great Britain, of course, is particularly at the time he was doing his work, it was much less about race and much more about social class. And here in the United States, we actually don't do a lot of measurement about social class, which is to our detriment, if you ask me, because we know to be poor in America is to be poor in poor health in America, regardless of your race, ethnicity. Next slide. And so this is social determinants of health as defined by the World Health Organization, and the part I really like to point out is this last part that has to do with economic social policies. And boy, in 2023 could not be any clearer that it also has a lot to do with politics, right? What we decide we will or won't fund in this country. Next slide. And this is just, you can skip this slide because it just is reinforcing social determinants and what they do and how important they are in health outcomes. Next slide. This actually, it's funny because when I used to talk about this, I talk about the fact that clinical care is sort of what I spent most of my career doing, and clearly like 20% of the impact on people's health outcomes is what I used to do, right? But then we have social and economic factors that are 40%. But the truth of the matter is, they're actually 80%. Because if you think about health behaviors, who lives in neighborhoods where they can go out and run in the park? Who lives in neighborhoods where they have easy access to food, to high quality food, right? Physical environment. We all know about environmental injustice. So when you think about it, social determinants probably contribute 80% to people's health outcomes. Next slide, please. If we look at this slide, it is a reminder of the importance, at a minimum, of getting people to graduate from high school. Because look at what the odds of death do if you just graduate from high school, right? Oh, thank you. Had no idea. Okay, control. And so obviously some of what we see related to unemployment also has to do with education, right? But we look and we see African Americans and Hispanics in the state are much more likely to be unemployed in New Jersey. African Americans and Latinos are much more likely to live in poverty when compared to other groups. And why do I do this? And Diane is totally sick of this talk, because I refuse to do any talk about reach without grounding it in the actual why. I want everyone to understand that a lot of the issues that you're grappling with related to food, are related to these much larger issues as well. And so that's why. When we look about wealth, the New Jersey Institute for Social Justice put together this slide, right? And we look at white wealth in the state of New Jersey, which is about $322,000 compared to $26,000 for Hispanic families and $17,000. We obviously also get a flavor of some of the things that are contributing to some of the challenges that we see in this country. If we look at life expectancy versus income, we see that people who are in the top 10% of income earners on average will live about 15, and for men it's about 15 years longer than their poorer counterparts, and for women it's about 10 years longer. And then if we look at what drives the wealth gap, home ownership is big, income, unemployment, the things that you would expect, but pay attention here to home ownership, right? Because then pay attention to what home ownership looks like in New Jersey based on race, right? And the disparity that we see. By the way, we're going to have a whole thing on housing. There'll be another conference. We'll send out information. It's coming next year, but you know, we're going to talk about this even more. And so I wanted to show a little bit and talk about issues related to child hunger. And gee, rocket science that hunger is bad for people. And you would think that knowing as much as we know about how bad hunger is for people, we'd actually do much more about it to eliminate it, and not so much. This is some of the most distressing data for me. So this is the data, somewhere in the earlier session about NJ Shad. This is NJ Shad data about food. So if we look at food insecurity by race ethnicity, we see a similar trend, right? Latinos and African Americans in New Jersey are much, much more likely to be food insecure when compared to their white and Asian counterparts. But let's look at Atlantic, Cumberland, and Essex County, where more than 1 in 5 children are hungry. I don't understand this. And I particularly don't understand it, and Cara, you and I can have a conversation where you can help me better understand this. But with all the people at this conference doing all of the kind of work that they're doing, how is this the case, right? How is it the case that we have 1 in 5 children in 3 counties in the state who are food insecure, and in the state as a whole, 1 in 10 children are food insecure, right? We should find all of this to be completely unacceptable, completely unacceptable. And so some of what we are trying to help people recognize is this link between these social determinants and health. So what we see is that food insecurity leads to significantly worse health in children, more chronic illnesses, more asthma. The big one, though, is the rates of foregone medical care, 180% higher. So what we know is these children who are food insecure are also not getting into the healthcare system in the ways in which they should, that often not getting a lot of preventive care and that sort of thing. So it in addition to the nutritional aspect of why it's bad for your health, it's just bad for your health in many, many other ways. And so a reminder that there's no biological basis for race. And so we have to understand that the disparities that we see really are related to this very, very long entrenched legacy of racism and discrimination that exists in the United States. And so part of our thinking at REACH is that these have been such intractable problems for so long in this country. Let's try to more purposefully bring together the expertise in the academy with the expertise that's in community in more equitable ways to see whether or not we can come up with some better solutions. And so that's the whole premise of what we're doing with REACH. And so now I will turn it over to my colleague, Diane Hagerman, who's the executive director of REACH, who, thank goodness for me, has the responsibility of running this thing day to day. And so thank you, Diane.
Thank you. All right, I'll come out from my row, I guess. I don't know that I can use my left hand to So I'm Diane Hagerman. Thank you for joining us for this last session of the day. And I'm going to talk, about what REACH is, what we're doing on the ground, what we're doing in the communities where we are in the state. Just a little bit of background. And Denise covered most of what I'm going to say in her 5 minutes this morning, but in case you weren't here. So we are funded with a $10 million grant from the Robert Wood Johnson Foundation over 4 years. It is a university-wide, across all of the Rutgers chancellor-led units, presidential initiative. We're based in the office of the Executive Vice President of Academic Affairs. And our goal is to improve health outcomes. REACH is the Rutgers Equity Alliance for Community Health. But you won't hear us talk about healthcare very much because that's the long-term goal of the work that we do focused on social determinants. Our 3 cities, Camden, Newark, and New Brunswick, our 5 social determinants: education, employment, food access and security, housing, and population health.
So let me just interject here. So part of the reason why you hear us repeating this like 100 million times is because we still get people who write grants to us for transportation. And if you have any thoughts about wanting to work with us for grants, we only fund
Those 5
things in
areas.
these 3 cities. And so that's why we're being such an obnoxious broken record now. Just so we're clear.
And really, our work is focused on this academic community partnerships. We cannot do this work, and we will not. You'll hear me talk about the funding shortly. We will not do the work if it's not an academic community partnership. And this is, Denise's line, nothing about us without us. I've worked, before I came to REACH, 20 years working as a grant maker in communities. So I know, that's why I'm here. I came because I believe in the expertise that's happening, the work that's happening in communities. The experts in communities need to be partnered with the folks at Rutgers who are doing research and also passionate about that work. But separately, we weren't getting as far as we could by working together. And folks who live in the community are also an incredibly powerful voice in the work that we're doing. And it's really, our long-term is to change the way Rutgers faculty, staff, and students are partnering with people in the community and change the way communities see how Rutgers is working within their communities. And it's all for long-term sustainable partnerships. We're not focusing on time-bound projects with our funding and with our work. Everything is for the long term. So this is our funding. Denise mentioned this earlier. We have a $10 million grant. $4 million of that will be granted out for this work. We've already awarded $300,000 in grants. We're right now reviewing proposals to award another $1.5 million. And then you'll see the dates of the announcement of the next round of funding. We have 2 kinds of grants that we fund: community impact grants. Those are the ones that are taking, it's the end of the day and my brain is not working, projects that have already been done, implementing them in communities, building on projects that have started in communities that show promise. Our research seed grants are for researching what could work in a community, working with faculty and community working together to see what could work there, collecting information to inform future work. Here is the eligibility criteria, and it's important for you to be here in the room, other than Cara and Daniel. Our funding goes to Rutgers faculty. That's just because of ease of getting the funding out. There is a requirement. They must have an active, equitable partnership with at least one community partner in the community where they're doing the work or that serves the community of New Brunswick, Camden, or Newark. We state that at least 20% of the grant funding has to go to the community so that it's investing in the community for that long-term change and long-term partnership that we want to see. Again, the work must focus on one of our 5 social determinants in one of our 3 cities. And faculty and staff, full-time faculty and staff within Rutgers are eligible to apply. It has to be related to their work, though. REACH is new. It's new to Rutgers. The work that we're doing is new, so we've learned from each round of funding. But it's very important that we know, that we see in a proposal that, and this is why you guys are so important in this here today, that a community partner is part of the development of the work that's going to be done. We have, we get proposals, we get letters of support that say, yeah, we're in favor of this. We want letters of commitment. We want to see, what are you going to do? What are you contributing? How have you been involved in the thinking about this work? And then we'll make you sign a letter of agreement when the award is funded saying, yes, I'm an active partner in this work. And that's really not, that's to hold our faculty accountable to having these relationships and not just picking up the phone and calling someone and saying, hey, will you work on this with me, and then working on it alone until the award is funded. Like I said, it has to be shared with the community partner, and the community partners have to be nonprofit organizations or government agencies. So this is, like I said, we've gone through about half of our $4 million in funding. This is our next round that is coming up. So we will announce the $1.5 million worth of awards toward the end of this month. And then our next round of funding will open on March 6th. So we'll start talking about it before that for grants that will ultimately start in July of 2024. Oh, and that's my last slide. But so there's other work that we are doing, and Denise mentioned this earlier. We're starting, after the first of the year, we are we've invested in a database that will showcase faculty, or will have faculty at Rutgers that are doing work in community. It'll highlight the projects that they've done, the projects that they are doing, the coursework that is related to, who their partners are. It's going to be public-facing, searchable database, so a community partner can go in and see what kind of community-engaged work is happening at Rutgers, what might be in their area of interest, what faculty they might want to connect with if they don't already have relationships, and vice versa. Our faculty can search and see what kind of community agencies others have worked with, partner with other faculties. So we're trying to build these relationships within communities, across the university, to have stronger, more powerful work for the long term. So we wanted to have a conversation with you guys today about your experiences in either working as faculty with community working with faculty, what we might be able to gain from that to strengthen the work that we're doing or inform the work that we're doing to ensure that we're breaking kind of this model of Rutgers coming into a community, doing their research, and then leaving with not really leaving a whole lot there in the community to move forward. So if you guys have experiences or suggestions, thoughts, and I know, we have several faculty, and Nicole, it's good to see you, on how this kind of long-term community engagement could work better or work with the kind of work that you do. And I know I sat in your session earlier today talking about, and that was fabulous, having students and faculty and community-based organizations all together talking about the work that they do. Because we are committed to, and Denise, hasn't said it in a while, but, if this work fails, it means she fails. I'm not going to let that happen. And we've got great people from Rutgers. We have our collaborative learning tables, and we have an executive committee, and people across, I'm still meeting people across the 3 campuses that believe in this kind of work, and we're just trying to strengthen it and make sure that it's more cohesive and that we're aware of what everyone is doing so that we're not duplicative, everything that you talk about in your work every day. So I'd love to open it up if anyone has thoughts.
So my name is Wanda Moore with the Camden Dream Center.
Oh, we need the microphone. Sorry, microphone.
We're recording, so we need to use them.
So good afternoon again. My name is Wanda Moore. I'm with the Camden Dream Center. We have a Feeding America grant that we're working on out of their Equity Impact Fund. And so we are building a hydroponic farm. So we are working on that, trying to get things through from the architect into the city and to start building. We're also adding to that Act STEM, understanding that our young people, even our youngest scholars from 2 to career, need to understand their connection to food. So we have our pipeline. But one of the comments that struck me about this presentation, actually there were 2. The first is when I think about community partnerships as it relates to university, what happens on the community side, and my experience is that that particular center, maybe let's say reentry is hot. And so we're working on safer cities, we're working on this, and so the school, Rutgers as well, you know, will invest time, have everybody come to the table. Then when that grant funding's gone, or that chair is gone, or there's a change in the leadership at the top, it no longer exists. So those of us in the community can't, you know, don't have this neutral convener, if you will, moving forward with the conversation. So really it's structural, and unless there is a commitment even to reach, in my opinion, for a long-term commitment to never go away, right, until these social determinants of health go away, right? I just don't see until we have a real honest conversation around that structural piece. So that's one. Then I think also when we talk about the community, I wonder how much community feels welcome on campus, right? So we can have these partnerships and we can do those things, but if the people that we're trying to serve don't feel welcome and or invited or a part of the conversation, and I recently felt this really strongly. I was working on a project, had one of the Rutgers campus actually do the evaluation for our project, and a community partner, after we went through everything, and yes, I gave Rutgers a hard time because we were doing different things, and they kept saying, no, Wanda, apples and apples, oranges and oranges, we have to validate the study, we have to do this, but it was community, so we figured it out. But then after we got it done, the community partner came to me and said, yes, it would have been helpful if some of the questions on your survey were designed by those of us in the community. We had some information we wanted to know. And for me, it was just a dagger because I thought I did it. Thought I had everybody at the table, thought I had all the voices. And they said, no, because we only looked at the research and the evaluation from how the university saw it. And I, as their champion, didn't say, well, let's see how they see it and what some of those questions are. But they made sure they corrected me on that. But in any event, I just think, how do you welcome the community as a part of it, and where is their role in this? Well, I love the projects, and I've seen some wonderful things happen. You have these cylinders of excellence, but I don't see the connection thread that actually moves the needle in our communities and across the population we're targeting. Thank you.
Girl, you hit the nail on the head. This is absolutely the history, not only of Rutgers. I mean, I think to be fair to us, this is the reality for all universities. And in part, it has to do with what we reward faculty for doing. So we don't reward faculty for engaging in long-term sustained relationships with community. We reward them for developing this survey, getting the results, publishing the results. And quite frankly, these faculty don't want to know what those community questions are because they're going to mess up the survey, right? I mean, that's how we think about this. And so one of the things that we're trying to do with REACH is to take a deeper dive and say, how do we begin to nudge the value structure within the university that's going to reward people for doing sustained, longitudinal, committed work in partnership with community. And it's hard because, so there's a subset of us who come to things like this, right? But I want you to picture the physics professors and the old English professors, and I don't mean their age, I mean old English, the people who are, all of these hard scientists who are like, no, if you're not doing basic science research and getting NIH funding, you don't deserve to be tenured. And a lot of them are in the faculty senate who then vote on whether or not we can make these. So it's an uphill climb, don't get me wrong. We are totally going to be about fighting that fight. But it isn't as if people like three of us here who are faculty working in communities can just go in and say, okay, we want this changed, and I think I should be rewarded for this. And the university just says, oh yeah, great idea. Really, really good news, though, is that all three of our undergraduate-related chancellor-led units, so Camden, Newark, and New Brunswick, because RBHS is a health sciences component, is a world in its own. I live there, believe me. But the other chancellor-led units are really doing some very significant work on figuring out and tackling this issue of how do we reward people for community engaged scholarship. The thing that I struggle with is, for those of you who are community partners with us, is to try to see how much leverage you could have. My fellow faculty, close your ears for a second, because I'm going to say something you may not like. So some of it is for those of you in the community, right? And you have this. In listening to what you described, your partnership is like with the School of Social Work, you've got this stream of students who are continuing to come, right? So some of it is when faculty come to you and say, oh, I want to partner with you, how much can you say? Well, that's fine, but I need at least a 3-year commitment. And I need you to figure out, unless there's a specific project you need done, because sometimes that's the case. I mean, sometimes you don't want a 3-year commitment. You just want, come in and evaluate this or whatever. But if you are having some students do longitudinal work, how much can we start to say on the committee? Because we need you desperately. We on the Rutgers side need places to have our students work. And so you say to us, all right, these are the things that I'm interested in your students doing, right? You give me a 3-year commitment, we can talk. Because if they can figure out how to do it for 3 years, generally they can figure out how to do it for longer than that. Because your worst nightmare are these one semester kind of, oh, this student came in and did this project, and then you got another student who comes in and you need them to follow up on that one project, and they're like, no, I have to do my own new project. We need to also have our students differently understand that it's a two-way street. You're going to learn from community, but you need to offer something that's real and tangible to your community partners, because that's our obligation. So believe me, we're working on it, but it's a struggle.
If I can just throw something in for the current internships that we have, they're 1 year. In that year, my goal is to convince them to go in the nonprofit work. Anything else is gravy. So we try to identify, from that perspective. But to your point, if we had something that we really wanted to study over a period of time, certainly it would be in our best interest to have, say, one person that's a senior that's going to go through their master's program. So then you would have, and if we're talking social work, you would have someone for 3 years minimum. Yeah, and then in that case, I think you would need to work with social work and say, what kind of partnership can we have here? This is kind of what I'm looking at. What can we do about housing or something like that? Then work what is their goal? What does they want that social work student to do? When I have my goal of, I want to know, what do I do to change something?
And the bigger challenge with that is that the School of Social Work doesn't want that student to be with you for 3 years. They want that student to rotate out every year. And mostly I get that, to be honest with you. I do understand that. Although I think for a subset of students, if you can demonstrate how the student is progressively learning a different set of skills while they're with you and not just doing the same thing for 3 years, I think we should be more open to those kind of engagements.
Seems to me too that the students might have more success, right? I'm thinking about some of the marginalized students who aren't able to get all the way through college. I wonder if they were to stay connected in any field, any professor that had a genuine interest in them, whether or not we could see those indicators. But as thinking about your presentation, as I went through it, I was like, we could actually talk about each one of these slides all day long, right, around what are the solutions, how do we begin to dismantle that. And I say that because the feedback, as I see it in the community, is they're tired. They're really tired of the injustice. They're tired of people talking about it. I have one partner came out, and we're in a room with a really major donor who said, yeah, we might take your money, but first we want to know how you harmed us in the past. And I went, this is going to be interesting. So I was like, ooh. Right? And so there's a lot of conversation. And even when we were talking about working with some of our partners about just some of the research and things that we wanted to work on, we get, we're going to have to send that to the IRB. We'll get back to you. And then some of the community partners says, well, what if we had a community IRB? And we'll let you know if you could do your research on us. Right? So they are talking about dismantling. They are talking about going after the structure. So we really need to have this conversation, right, and understand how to bring the two together, because I will always be convinced that working with a university partner is critical. You have the resource, you have the data, right? How do we work together so that we move and make real change? Thank you.
I love that idea of a community IRB where you can pass the Rutgers IRB, but then does this community group say this is legitimate to do as well? I do a lot of speaking about health disparities, the slides I showed you at the very beginning. And one of the things I'm increasingly concerned about in doing these presentations, I've actually changed the way I do the presentations for a community audience, is that when we show this life expectancy data, it translates for some people into a decreased expectancy for life. And what that means then is people engage in behaviors acting out of I have a decreased expectancy for life. And so if that's the case, then why don't I just enjoy as much as I can for as long as I can, right? And I really want to reframe that so we begin to say to people, there are things that we can do to change this data. This data is not destiny, right? And how do we have those conversations? Because the other part of what you just said is how do we work with communities so that they have more agency? Because right now, just to be very honest with you, people could say, well, you have to go through our community IRB, and the university will say, yeah, no, we ain't gonna do that, thank you, bye, right? Because we do have the resources. We have the money. We bring the dollars to community for a lot of this work, right? It's not like we've built capacity. And a lot of what Diane actually did in her prior life was to help build capacity in communities so that communities can get their own money and say, you want some of this money? You're going to do it our way. But it's a small part. You may want to talk more about that, Diane, in terms of what you saw. Diane used to be with the New Jersey Health Initiative. Thank you, NJHI. Just for the sake of transparency, wearing my sort of non-Rutgers hat, I got funding from that. And it was very much community-based funding that had to go through the university, but the university had nothing to do with it. And it was a very different paradigm. I mean,
yeah, that's my belief, and I try to translate it into the work that we're doing now. We did and I can kind of give an example. We had somebody from Rutgers come to us at NJHI and say, if you give me $500,000, I can then work with your grantees in these communities to do X. And our answer to them was no. We give the money to the community so they can select who they want to come do that X work with them. And that's still what I believe, even now being at Rutgers and part of Rutgers, that's still what I believe. And what REACH was built on was the community has to have a voice in it, and the community has to agree. And I love the thought of, and when you were talking about, if you could ask for them, we need a 3-year commitment at least. That's why it's so important to us that the community partner is helping design any of the work that we are funding through REACH. I will never lose that focus that the community has to be at the center and has to be an equal, if not more powerful voice, because that's where we're trying to make the change. And I don't talk about, there are systems and structures within Rutgers that REACH is also trying to address. I don't talk about that out loud because then it puts it out there and it gives me heartburn. But we are as equally committed to changing those structures within Rutgers that make it easier to work with communities. So the community is always the focus, the center focus.
How long are the projects funded for?
That's a good question. I didn't put that up there. So they can be, because the dollars, we're using our grant dollars and our grant, we're actually 2 years into our 4-year grant. The projects can be anywhere up to 2 years. So our grants right now are up to $200,000 for up to 2 years. And it's, based on what the project is, we saw a good mix of 1-year, 2-year projects and different dollar amounts.
And just,
And we do. We have Marielle, I wish she was in the room. We have a grant specialist on our team at Reach who is actively seeking, she is always finding opportunities for funding for the projects that we fund, as well as continuation funding for the Reach overall. But we're seeing a lot of opportunities that, and we're just looking at timing that's part of what we ask of our applicants also is how are you going, like I said, this isn't a time-limited funding opportunity. We want to see how you're going to keep this work going. So what other sources of funding do you have or will you seek? And that's where Mary Alice, our grant specialist, comes in and is always passing opportunities out to our collaborative learning tables or to our grantees, and specific ones to specific grantees. But our funding is 2 years.
are we allowed to partner with faculty at other universities as well as community partners? That's what I was asking. I was asking for someone else in the room.
Well, but they can partner, they can work on the project, but they wouldn't be considered a community partner.
So you
But
could have a community partner.
and
a
another
faculty
university
partner,
partner?
and absolutely.
Yes.
Okay.
Yeah,
Yeah.
so definitely do that.
The point that you made about the students and sort of having sort of a longer term relationship, particularly for marginalized students, like they need more of that consistency to help them get through. Like I've mentored upwards of 60, 70 students across my career that I usually keep them for a couple of years. I always have at minimum 2 or 3 years, and then because they need that consistency to help them sort of develop over time. And so there are different ways you can sort of begin to sort of bring them in at one level, and then they sort of start to progress and move through. But it gives them enough of a stable base that then they know that they can continue to work on this, and it starts to build their capacity and their job opportunities. Because what you're looking at when you look at that data, that suppressed income, that suppressed home ownership for those BIPOC communities, that's real dollars that they can't use. So I love this idea that you're starting at 2 years old, sort of all the way through, but then having opportunities where students are able to stay a couple of years with faculty or with communities to sort of build and learn. I mean, that's when they get their most learning. It's not when they're like in and out, because then it's just like, oh, that's just something for your resume. That's not really authentic engagement, right? And so, and you're not going to learn the most. And I think most of you might have heard Leslie, my student. Leslie's been working with me about 2 years, maybe 2.5, and I've seen the development, right, over time. And now she's, we're working, she's on all the calls with the biostatistician. She's getting text message from the community partner. Like we hear it, like, in the community, like, hey, did you do this or do that, or checking in and all that. Like she's fully part of the team, but that, takes some time. And I think it's better for the community, and it's better also for the student, particularly BIPOC students. They need that time to develop.
Can I just add to that? That is one of the other structural pieces that I believe I observed too in working with some of the faculty in the schools as they were working with young people who moved on. Faculty generally are not awarded for keeping connected, right? Because they'll come back and say, oh, I want to be with Professor so-and-so, even though they finished the class 3 semesters ago. But there are certain people in the faculty who will reach out to that student and say, hey, what can I do to support you? But that is not valued, or at least I've never seen it, where they go back to my folks that I know work. They say, we're so grateful. You've been working with him for 5 years. He's been out of your class for 10. This is wonderful. But they don't get really any other, benefits or recognition because of the work that you're saying, right? So it's both ways. Yes, it supports the students, but it also helps, right, to acknowledge that faculty that's doing that's going to make the difference in their life outcome. Right, so I just want to say it goes both ways. So thank you for doing that, because I know that it's effective.
Daniel?
I'm going to piggyback from what Wanda was just emphasizing, from what Nicole was just saying, and just emphasizing, it goes back to, and you've heard me say this before, if a faculty member has built a relationship with a student over their career, over their tenure, the student's tenure, and the faculty member is working on their tenure process, then the community partner is going to be there, right? Like, we are blessed to be in these spaces with them because that's where the institution is. At the end of the day, it's the institution that still is our barrier. And I love what you had emphasized, and I don't know, maybe I need to approach our partners differently in emphasizing, give me your long-term plan, and not just the one semester, because we know that that's not enough. But I'm thinking of, is it our partners advocating on an external port to folks internally? Is it having faculty members on Faculty Senate being able to talk about this in regards to bringing it to, I know that administration is working towards this in regards to really making sure that community engaged scholarship is seen, but service with our students is a part of their package, but it is not the highlight. It is a small, part. It is not where the majority. Now, to the soul, of course, that's, those relationships with those students and the authentic relationships with the partners, that's what makes the work authentic. That's the retention. That's the reason why we hold on to our faculty members who want to continue to do the work in the community. And the reason why our community partners then invite us out for dinner, right? Like, and the relationship building that comes out of that. Far and few between. And that's the downfall. It is an institutional, there is a large rock. We are pushing it.
I wanted to clarify something I said, though, about longitudinal. So I wasn't necessarily talking about 3 years with one student, just to be really clear. So I was talking about a student a year over 3 years. If you can get a student for 3 years, that's great. But I think it's more this notion of you as an educational program need to be committed to us for more than just the one-shot deal. And just to reinforce, Daniel, what you were saying, I mean, part of the challenge is, and what you were referencing, Wanda, as well, is we don't get rewarded for mentoring students. And mostly we get rewarded if we don't mentor students and we're over here writing our papers and getting tenure, right? Now, to your point, though, it doesn't reward your soul quite in the same way that working with the students does. I mean, Cara's an example of somebody who kind of does it all, right? So you got tenure, you work with students, you're in the community. But it's a struggle, I would say. I mean, it isn't that the university is structured to allow the vast majority of its faculty to be able to engage in this range of work and be appropriately rewarded for it. If I'm wrong, please correct me.
No, it's true, and having just gone through the tenure process, I can say that it's very much in your face when you look at what they're asking. How many patents do you have? How many, all of the, how have you commercialized your work? It's like, I have not commercialized my work, and I do not wish to commercialize my work, so that everyone says you have to make this, tell your own story in your own way and ignore what the categories are, but it's kind of hard sometimes. There's no way to spin 0 patents. There's nothing that I do that could possibly fit in that box that I could say. But I did actually reach out to the Office of Research, I guess is the name of it now, about not commercializing, but creating a license, or I forget even what the word is, but something where we formalize that we have these like resources that maybe it's a license, but they would be available for free, but that I could, that Rutgers I would get some kind of credit for having it. And after 1 or 2 emails, they completely ghosted me. They said, oh yeah, we can work with you. It doesn't matter if you're not trying to make money. I know it's for the community, and there are certain things that we can do that are for the community, and that's fine. But I never was able to move it forward because they were like, oh, we're too busy working on something else. And I was like, okay, I'm going to guess that something else is earning some money for the university, and what I want to do is not. And so it just feels like in every direction that you turn, there is that, and maybe I shouldn't say this, but it just feels like there's barriers to doing this in places where I didn't expect to find them necessarily, that they're just there. So, and not lack of support.
One of the things that Daniel said sounds like a way that we may bridge the gap, and that is if the nonprofit, our community partner, if we knew their long-term strategic plan, as the students come in, whether a semester or for a year, we know that we could plug in here, this is what they're doing, as opposed to saying, well, what are you interested in to the student and just hit or miss. But if you wanted to get at that, we can say to our partners, "Yeah, what's that?" And you might have to work with them on the long-term strategic plans. But if they had one, right, that would tell us, so when they came in, but not just for Rutgers, for every school, I was thinking, oh, I'm gonna tell my friends at HBCUs, I'm calling right now, make sure that, you know, you're thinking through what that community partner needs long-term, so as students come in, you can plug in and it will start to just a little bit fill those holes. But at the same time, and based on your last comment, was the fact that now that community partner can let the university know as they acknowledge you and say, we're really grateful for your long-term partnership. I know you get a lot of accolades. You don't know, we've been watching your work and looking at the videos. We've been talking about everything that you do. I'm just saying. So the community really is aware of what goes on. And so then we can then say, you may not be making a lot of money because you don't have that patent for the school, but we recognize and we acknowledge that she is an authentic partner and really wants to work with us. And that too has value. That's where you're going to find your equity, right? Your equity, inclusion, belonging plan. That's there if you truly believe in it and truly value it.
So there's community IRB, and then there is, if you're community engaged, you need community letters in order to be promoted. And they will have equal weight to your academic letters, right?
Theoretically, you're speaking.
Oh, totally theoretical.
Okay, yeah.
Oh,
I was
yeah.
like, wait, did I miss something?
Oh, no. Yeah, I'm totally living in La La Land when I say that out loud. But yeah. You saw I prefaced it with the community IRB part, right? So we have categories of La La Land here, but yeah, but you know, I can dream.
If these institutions are like anchor institutions in these places that really want to sort of see the communities around them lift up, then they would, I mean, it has to change. Like, this model of staying the way it is can't stay. Like, the disparities have just widened and widened and widened. Like, it's not getting better, so we can't just use the same system to continue to promote the same madness. Like, this is, you know, we know that communities need this engagement. We know that we've divested in communities for generations. We know that now we have to reinvest, but we want to reinvest in a piecemeal way so that it's not sustained. We want to give tiny project grants that aren't sustained, and we're expecting all of these outcomes. Where are your outcomes? It's like, you divested for generations, and now you're going to give us one grant for one cycle and expect all these outcomes of, it just doesn't even make academic sense, you know? And so the community can see that a mile away, and, you know, over the years, it's been like, people are tired, you know? And so now I think the change is gonna have to happen. So I really like the comments that you said about, you know, having like them coming back with strategic, and a lot of this is happening. A lot of the money is, like Diane knows, you've been pushing it back out to community to make the decisions. So I think we're at a crossroads with all of this, because the disparities are just widening to the point where it's hitting everybody. Before, people didn't have to care. Now they have to care because it's hitting everybody. Universities, hospitals, I mean, every sector of the community is being affected. So we're gonna have to do it a little bit differently. We're gonna have to authentically listen, reward. I mean, people need time. Like, you're not gonna run these relationships without trust. You've built generations of distrust. So it's gonna take time. Faculty have to be there. They've gotta do this. It's not like we're not working. It's like, you want to make sure these things are happening, then we have to start incentivizing the faculty to do the work authentically, to make it where we're like, okay, now we're gonna be able to stay with them for the long term, since we divested for a long term. So
It looks like things are wrapping up. So let me just say two other things. One is, I'm going to get on my students as advocates soapbox again. And I come to this place actually as a family physician who have seen decades and decades of medical students who work in free clinics, right? And it's fine. You know, free clinics are necessary and all that good stuff. But the goal actually should be to eliminate every free clinic in the country. So there were free clinics when I was a medical student, right? And one of the things that I have advocated for decades and completely failed at, by the way, I'm totally sharing my burden here, is every one of those students needs to be required to write a letter to their congressperson about the impact of being uninsured on the lives of the people they care for, and advocate for change, for universal access to health care. Because what we do is we take these students, and again, I'm talking medicine, which I know most, but it happens in other areas. We take these students, they work with the neediest of the neediest. They learn so much from our patients/clients, and they give a little bit in terms of, yeah, you know, they do the service or whatever, but they could make so much a bigger impact if they really were willing to advocate for change. And I encourage all of you working with students, join me, succeed where I have failed in getting these students to be advocates for this, to have these social work students saying, you know what, nobody should be hungry. Let me write Cory Booker. And let me write, I don't know who the congressperson is around here, but you know, mine is Mikey Sherrill, and have them understand what I'm seeing and why this is important. Because you know what? These politicians listen to these students differently than they listen to people in the community. Sad, but true. And so I think we should add that to our work as well. And then we should end?
Yeah, I think so. 4:22. Yeah. So
Okay.
we're
And
good.
that's Mary Alice Rocks, who we were talking about, who was like getting the bucks. So just want you to know she's real and working on it.
All right. Thank you all very much for coming, and we're going to go back into the main room for the closing session.